myself. And we're talking with Dr. Lynn Dennis, podiatrist. If you have any questions at all that you'd like to ask Dr. Dennis, you are more than welcome to do so. And our phone number here is 648-5510. You mentioned a little bit ago, Dr. Dennis, about the plantar's warts that people get. I had them on one of my feet when I was a kid, and one of my girls had it. From whence does it cometh, and how does it goeth?
Plantar's warts are viruses, and there's actually multiple different types of viruses that can cause the plantar's warts. Some people will just get a solitary wart or just one wart, and some people will get a thing called a mosaic wart, which are the ones that tend to spread all over the bottom of the foot. So you just pick them up. You just pick them up in the showers. You spread them between family members. You can pick them up in locker rooms or gyms or pool sides. You won't get them in the pool, but you'll get them in the area that the water has been splashed out and dechlorinated because it can't kill the wart virus. Once it gets there, I'll tell people a lot of times to go try a Dr. Scholl's wart medicine. You know, they can try that, put the acid on, pick the wart out, put more of it in. Requires some persistence because you've got to get down to where the wart is at. Most of the time, by the time patients come and see me, they've tried that. They've tried the over-the-counter wart medicines. So we will freeze them in our office. We can cut them out, especially if they're those big, deep ones, because no matter how much acid you put in there, all you're doing,
you just keep to the bottom.
Yes, you just keep regenerating by the time you're getting to it. Sometimes we'll use a real strong acid called salicylic acid, about 2.5 times stronger than what you get over the counter, with weekly applications and scrapings, and we can eradicate most warts. It's sometimes it can be stubborn because as you're treating some, others will come.
Well, surely, as long as you ignore it and hope it'll go away, which seems to be human nature, it's just propagating.
It is. Sometimes the warts, because they lay outside of your immune system, sometimes your body will actually realize that they're there, and they'll spontaneously go away on their own. But sometimes they don't, and then they'll spread. I had one gentleman who came in who had warts literally anywhere that his toes or his foot touched the ground. So on his whole arch, every one of his toes, because it had gone so long.
Oh dear. Well, when you've got a mass like that, what in the world do you do?
We had to take that gentleman to the operating room and basically had to cut off the whole bottom sole of his foot to get rid of all those warts. And I see him periodically, and overall he's really happy because before he couldn't even walk because the warts had gotten so bad.
I should think not.
He had a little scarring, but we would expect that, as much cutting as we had to do.
Now, are the plantar warts the same warts as somebody will get one on their knee or their hand or something?
The warts are kind of warts. I mean, there's different, like I said, there's multiple types of viruses that cause them. The reason plantar's warts get such a bad rap, basically, is because they hurt, because you're walking on them.
Yeah.
So and they can get thicker. The skin on the bottom of the foot is 7 times thicker than anywhere else on your body. So by the time we get to those warts, they may be several millimeters thick compared to the ones that are on the top of the fingers that are just kind of going up. Those warts kind of go in and pushed in.
How about the business of people going barefoot? Is that something you would advise or advise against?
I would advise against, obviously, because of things as warts.
Support.
You need the support for your plantar fasciitis and foreign bodies. There are so many things you can step on, hurt yourself on. Needles, rocks, slivers. Every summer I see someone having jammed a piece of wood in their foot from the wooden decks.
Sure.
So, and then you get an infection.
She forgot meadow muffins.
Yeah, you don't want to step in that with your bare feet.
So you should wear shoes.
If the podiatry profession were to design the optimum shoe, what would, notwithstanding appearance and so forth, what do you think it would look like?
I think there's some pretty good models out there right now. I think the New Balance high number shoes, they have spent a lot of money and energy and technology for the shoes to try to simulate the gait. The striping on the bottom of a tennis shoe is not for cosmetics. It's actually, you know, like you see a dark gray and a light gray.
Yeah.
Those materials are actually different durometers, which means different thicknesses, and they kind of support and cushion your foot as you walk through the pathway. So, and I always like a shoe that's got a wider sole, because the more surface area you can put on the ground, the more pressure you can relieve on your foot in general. So, you know, a nice New Balance with a wide base, a nice New Balance walking shoe, or a Beast, or a Saucony. I don't like the Nikes that have the air shocks. You know, they have those little pods.
Yeah.
Those
right.
and I don't like Skechers personally. The rocker ones.
Yeah.
That's what I was going to ask you about. Now, they say that's just the commercials say that they're just the be-all, end-all, because they exercise your foot and they exercise your leg, and your whole life is going to be better. Your hair will get curly or something.
There's a lawsuit about that right now, I think.
Amen. Is that right?
I think so. I think from what patients have told me that they've heard, and, you know, I don't know if it's true or not, but they said that was false advertising because there was no documentation to prove it. So I've heard that they're not going to continue to carry those, you know, rocker type of Skechers.
Is that right?
I have heard that.
They looked to me like they would be uncomfortable, because that's not how we walk.
No. And they're very unstable laterally. A lot of ankle injuries from falling off the side of it.
Fall off your shoe.
Yeah, exactly.
Do the effects last more than 4 hours?
Call your doctor.
Doctor, I suppose that as we get older, that we create ourselves more problems. And what is the most prevalent problem that you see older people come in with, or that you treat?
Probably the problem that I see is onychomycosis, which is toenail fungus, and the difficulty of cutting the toenails. So mostly my older people are coming in to get their nails cut and their calluses cut because they've got arthritis, their foot is misshapen, they're getting pressure points, they're getting sores, corns, and calluses. So that's what I'm seeing our senior population. And falling. I'm seeing a lot of falls. And even more and more all the time. I think because our general population is getting older. So we're trying to minimize
Yeah, that's
falling.
a gift of science. Thanks a whole bunch.
Yes, isn't that a gift?
This is a swell thing. Let's talk some more about this nail business. How could you avoid having that fungal infection? Is it an infection?
It's a fungal infection, yes.
Uh-huh.
It's basically athlete's foot. You know, like when you get athlete's foot, it's
Yeah.
the same type of fungus that's in the toenails that it gets onto the skin. The biggest thing is when you first notice it is to start treating it, because once you don't treat it, it will continue to spread and get worse. When you have maybe a nail that's infected, the topical medicines can work. There's a thing that we sell in our office called Formula 3 that works pretty well if you use it, and you use it diligently. The failure is because most people use it for a week or two and get tired of using it, and then it doesn't work.
Is it a topical thing that you just paint on
It
like
is.
nail polish?
Yeah, that we do have that now too. We actually have colored nail polishes that actually have antifungal medication in it.
Really?
So if the woman clears the fungal infection, then they can use an antifungal toenail polish that kind of helps prevent it from reoccurring. We also have oral antifungal medications now.
Really?
And they have, years ago they were very, very expensive, so it was very cost prohibitive to use them. But they've become generic and they're much more inexpensive. The problems with them are that they are filtered through the liver, so if patients are taking medicines that go through the liver, you have to really watch the liver enzymes.
Uh-huh.
And then there's also laser. Not that no one here in town does it, but there is actually laser treatment for fungal toenails. And the theory behind that is that you superheat where the fungus grows, and it actually kills the fungus.
Really?
Very expensive, you know, about $100 a nail from what I've been told, but does get rid of the fungus also.
You know, Jim, Judy and I honestly go to try we put a lot of work in trying to bring our guests to us on Viewpoint. For instance, last week we talked about hospice, a very important subject. Today we're talking about health care, foot care particularly. We'd like our guests to let us know that they appreciate what we try to do for our listeners. So if they have some questions, I'd urge them to 648-5510 or comments. Or you could tell the old guy to go home, and that'd be all right, too. I wouldn't mind that.
Go home and go to bed, right, Bill?
Not
Right. But we'd like to hear from our listeners. I'd like to do a little background, Dr. Dennis. You don't just become a podiatrist in 3 easy lessons. Take us through the educational background that you found necessary to be a podiatrist.
Okay. I started my degree, an undergraduate degree, at Michigan Technological University. Originally, I was going to be an engineer, and I was going to do biomechanical parts and joints.
Oh, really?
But I liked the people part more. So I had an advisor, and they said, hey, look into podiatry. So after the 4 years of undergraduate school, then you go to podiatry school. And you go to podiatry school for 4 years also. So 8 years of schooling. And then once you're done with that, you do a 1 to 3 year residency, which is postgraduate training, usually done in the hospital. I did a year at the Westside Veterans Hospital. So like we were talking about the flight, I have a strong love for veterans and for our military service.
I'm sure you met a lot of people you liked
I
there,
did.
didn't you?
Yeah, a lot of experiences in a veteran system. And then I did a year of private training with a doctor in an office-based setting. And then after that, I came down to Springfield and set up my office there and was there for about 3 years. And then Dr. Stewart died. And I had a lot of patients who came to me in Springfield and said, we need a podiatrist in Lincoln. I said, you know what, I can do that. I'm young. I'll go set up. And so I've been here now, I think, about 13 years.
Yes.
So,
And you have a land office business, don't you?
Well, she's a busy
Lots
girl.
of people coming
Well, that's
in
great.
going. Yeah.
Well, obviously serving a need.
Yes.
And I would presume the higher we get on the age spectrum, the greater those needs become evident. So we're glad to have you here.
And I love Lincoln. Lincoln's been a great community for me and all the outlying areas.
The other end of the spectrum, kids. What's the most common ailment you have with children?
Probably like I said, the warts or the ingrown toenails.
Children have ingrown toenails?
Yes.
Really?
Yes.
That's interesting.
And
About 12 to 14 years old, we'll really start seeing them having ingrown nails that are infected. Sometimes it may be because they're picking at them, or it may be they trimmed them incorrectly, or it may be that genetic component that we talked about.
What about athletic injuries, or would that come under the purview more of orthopedics?
No, we will treat athletic injuries. We do see quite a few fractures on children, trampoline type of injuries, just basically kids hurting themselves. We also see quite a bit of heel pain in children because their growth plate is right in that heel, and if they're active or if they're overweight, it makes that heel really hurt, and those children can really be suffering with a condition we call calcaneal apophysitis.
Now, weight is that's a real factor in our society today.
Yes.
My goodness gracious, across from Richard and I last night down there in Springfield, the chair said thank you when the lady got up. Oh, God. She was really. And I thought to myself, of a serious note, that's got to be terribly hard on her joints. Now we're getting down and going on down to the feet. Those feet are serious. This was incredible. And I mean, she outdid the Walmart ladies by a whole bunch, and that's a lot. But I guess that was a serious note. There's so much weight. There's so much weight going down in those tiny little foot bones.
Yes. And we'll see stress fractures from that, too. We'll see patients who are overweight, and they'll get little cracks in their bones for no reason in particular. Our guest is here, I guess.
Oh,
already.
yes, yes.
Yeah.
When he's in, he wants out. When he's out, he wants in.
Yes. Their bones will actually break because they have so much pressure on those
Sure,
bones.
right. Yeah.
And for no reason. They'll just get little hairline cracks.
Can that be happening to a youngster, too, if they're heavy?
Yes, I suppose it can be. We don't see as much of that.
Because their bones are more pliable?
Their bones are more pliable, but kids are more likely to break bones than adults are. Because if you think about
the way they live. Holy
not only
Friday.
that, what is our bones doing? Our bones are growing rapidly, so our bones don't put down as much calcium in a child. That's why you see children in casts more often.
Well, that's something new in the studio every day,
He was here last time.
Oh, yes. Well, we'll keep him. We've appreciated your presence this morning, Dr. Lynn Dennis.
Thank you.
You perform a great service for our community. We're glad to have you with us. It's always glad to get somebody who knows what the heck they're talking about.
Really? Because we got questions. We
Now,
just don't have answers.
we always try to close Viewpoint with a comment apropos of the subject matter. And this comes with a kind of a gender thing, and I'll apologize for that up front, but I think it's some truism. And it says here, a woman who keeps on trying on shoes until the salesman has a fit. Thank you for Viewpoint.